like, what's this thing where the task force now wears these bright blue sort of like semi-military jumpsuits?
Oh, yeah.
That's
What
the
is
public
that
health
about?
service.
Yeah.
Yeah.
Were you in Japan 2011 during the Fukushima
No.
earthquake?
No.
So I was there, and as shit started to go wobbly, the Adondo administration rolled out these bright blue jumpsuits that they wore for all the press briefings. And it was, the communication strategy was terrible because the only thing they kept saying is, hey, we think the pressure of the nuclear reactor is going down. Looking pretty good. They had a live shot over the prime minister's shoulder when the freaking reactor blew up. So it's like, the jumpsuits aren't helping, guys, you know? Like, it didn't really help.
They wear, it's like they wear the Coast Guard uniform.
Is that what it is?
Not.
That's
They
what it
wear
looks
the
like.
naval uniform as their normal was. That's why he looks
The
like
public health service?
Yeah, public health
Yeah.
service. But they wear it for their, like their BDUs. They wear the Coast Guard uniform. That's what the Coast Guard wears. It just says public health service.
Huh.
It's a weird
That's crazy.
it's a uniform,
You know,
non-military.
Called Admiral.
Come on, they've been
Yeah.
around for
Well, it's like
100 and some odd years now.
The public health service and NOAA, the two uniform, non-military
Right.
brands.
Crazy.
Yeah.
Yeah.
So they have to be their salute.
That's good news about Jack. That's a really good hire.
You're really
Really
watching
good
that.
fit for that
It's
job.
just, you know,
Yeah.
Yeah, it's not. It looks like the
Everybody's
Navy,
happy
but
with
it's
yeah.
I know. He's
it's not the Navy.
It's a good decision.
It's a good story.
I could not get on the call this morning.
Explain the
Yeah.
public health service. Because it's weird to see them, because I've covered
We
it.
used to have them,
Because
we
they
used to
also
have
work
one
on-
in Fort McNair, oh God, this is
They
40
work
years
on-
ago, and they would.
They work on the
build a mess
reservation
hall.
too. So when I've covered stuff at the reservation, at any reservation,
Yeah.
and you'll see some guy in a Navy uniform there. It looks like a Navy uniform.
And do they have dress uniforms?
Yeah, they have dress
do.
uniform. It's like
They
when you
do.
see the Surgeon General and he's in his Vice Admiral uniform, it's actually the Public Health Service.
Yeah.
So the-
And that
it's out there.
4-star, the older guy
Yeah.
who's been
They just
talking,
didn't make
Yeah,
she was
he's like a
absorb it in advance.
a pediatrician or something in civilian life who was appointed as the head of, because he's like the boss of the Public Health Service.
So he's like
He's
the
a 4-star,
equivalent
but he's a
of
4-star, and he gets the military.
I hope he gets the 4.5 half with the feather.
Why not?
Sort of look like a Knights of
No.
Columbus.
Hold on. I was covering,
And a sword.
Do you have a sword?
I was covering an event at
Is this on
an
here?
Indian reservation in New Mexico, and there was a guy dressed up like a naval officer there because he was the Public Health Service doctor who was assigned to that reservation, because they handled the reservation. Public Health Service.
Yeah, we used to have this guy.
Because they don't go through
mess
like any
hall.
kind of basic training.
Well, like, what are you doing here?
They should make them.
They just give them direct, they're all direct commissions. And it's only office, there are no enlisted people.
Of course, all
It's
our
only
fire
officers. They only have officers.
Let us know if it's a site plan.
But they come on base, they salute. You're a full.
Yeah, no, they got a cat
Uniform service.
Got the, they're an armed,
They're a
uniform.
uniformed, non-armed military
So all
service.
the Navy admirals call him doctor, all the doctors call him admiral.
I love the way that AP does the Navy ranks for doc. It is doctor parentheses, captain, rear admiral, brigadier general, I remember the name. And for chaplains, it is the rank, and then parentheses, chaplain.
Surgeon General was an anesthesiologist who'd never been in the military at all until Trump appointed him Surgeon General, and suddenly he's a
Chinese?
Vice Admiral. The
Pakistan.
black guy with the ball.
The press break.
Yeah, as long as said, yeah, he was an anesthesiologist who'd never been in the military at all, never.
The fact that you're broadcasting
Appointed
your
Surgeon
post on the
General,
full line
he
now.
got automatically went 3-star.
Public health service is just more obvious now because we're all so far apart. I've been
Yeah.
noticing them every day. There was like one with
Never
like
worked out.
Friday.
Yeah, it's like,
Sunny side
Okay, how are you?
years,
Oh, you're-
surgeon. Yeah, he was great. You never, you see him in his uniform, his beard, Brigham Young beard. Yeah.
So,
He was,
He was a vice
you occasionally see him in his sailor suit.
But he looked upon
Yeah.
With
He looked salty.
that sea captain beard of his.
What they did. Give the heart
He
through
could
the
be
whale.
pumping around on a step, talking about his prey, that he will, I will follow you.
Oh, Oh, cursed whale, I dare
I
thee.
don't remember seeing Surgeon General.
And
He
we
did
went
it.
out and put our Amazons out of
There's a
it.
guy selling a cigarette thing. He
Yeah.
started that.
Basically anti-cigarettes.
He was very PR, he was very
HIV.
Yeah.
But on the HIV thing too.
To go with your
Yeah.
house
Now,
and your
remember-
first.
Remember, don't use,
Huh.
He's a really good guy.
or Advil. It
He was the first really
He's the first one I
famous
remember.
surgeon
You should
general.
use Tylenol, not Advil.
How do you,
He did SNL.
Just too bad.
Can I
There's
just-
a big thing of Advil.
is the FDA such a?
That's when you know you've made it.
He was on I remember seeing him on
Try to
SNL.
remember, but better safe than sorry.
Right.
It's wrong. But
But it is
it was,
public health service.
Well, I'm one of the last.
Because you really have to look at their little rank, the thing
Because
here
it's
doesn't have a
Robert
star,
Esper.
that's a weird, and they don't have the Navy insignia on their hat.
anti-inflammatories are not helping with this virus and can exacerbate.
Okay, that's it. Switching.
I don't know.
I have big bubbles of bubble.
I like it's good for, yeah. You know.
Pardon me, Erica?
Yeah.
Who's it, Italy?
No, this is California, right?
In California, and then there's in Wisconsin or something. So much boys.
You know the problem is when
Better not
you
to
don't meet,
It was a,
Italy,
what's that?
Yours is just all over the
I think
country.
it's worse than Northern Italy, like Berlin.
now it's pretty much the whole,
It's not ours.
the whole group.
It was funny money to begin with.
Good getting out.
Oh,
It's been fun
I
getting
couldn't live without stress. Oh, buy, sell.
And, I think we're gonna allow more. But the guy I was with, he said to me a month because what? Then all
And she was like, oh,
I never saw it.
and it,
The public figures are amazing.
oh yeah, I mean, they had to get it.
It was, Brandon Thompson, great guy, really good. No, he's a bad fool. Yeah, yeah. He's on phone, Washington State. So the new guy could get,
Chaos.
he should be getting out of about. Just great, great guy. But you went around with him? You were-
We're getting to, we're too going on when it gets up here. It's still inside, it's still the hospitals, the civilians.
So we went to several times.
It's a
just,
civilian
talking
hospital.
about it.
And then,
We talked to the West Virginia guy who got
we're kind of premature right now, which is fine, but rest now because it will come back.
And went down and talked to the SF guys, they had no mission. They said, you got James, McNulty. From Ryan's. Good guy.
Also think,
I would go back and do something like that.
crises,
It's like 1 week, 2 weeks.
perfectly acceptable.
It's not a
And
full week.
kind of urgent sometimes, like I sometimes pay more attention, someone calling in, it means it's such important news.
The Russian.
It's not about how you look,
Looking at
it's just
another,
get
and the
it.
Syrian, Mexico. See, one of the trucks got
CNN,
that's what happened.
your body suffers.
And they opened up on them, and they said they took out their 50 and killed 2 of them.
I think the Sky Council.
But they said we don't need to go in.
It's this new system. where-
They've lost like 40–50% of their foreign area. The other thing, since they left Cavani Landing.
But I'm with Elizabeth. Elizabeth said she couldn't count.
They're back at the towns. Yeah, so it's like the other thing. And they said the first few nights they started with trucks. And they're pissed. Get that.
Those are the ones that go viral.
Heidi, get her to
And these are the guys that were
Like when they got her to die.
cut across.
They were really far behind.
Let's talk to Stuart.
They just don't care.
Looking for home.
I think tomorrow he comes.
Does he? You're home? Rest of the week? Just maybe-
Every alternate day. Every alternate day.
All the universities, schools.
Yeah. So Lita comes in next week.
Yeah,
If there is.
Really good.
there is a next week.
Starting with the
But it's, that's just the right time. How long do you know what you're gonna do?
younger generation knows how to
It's the end of the last
secretary should be down, should be in here momentarily, so do another
Oh, yeah.
Like 2 minutes, like 5 minutes?
two-ish.
Jewish man wanted.
Just a reminder, please, your phones, please make sure your phones, computers are on silent. And a reminder that we do have the phone lines up, and so we'll have, I think we've got upwards of a dozen media on the line to
No more than
for follow-up questions as well. So.
Stand by.
allows you, New York residents, city residents should be prepared for shelter in place order. What does that mean for us if DC goes to work?
No, journalists would be considered essential workers.
But some people, they still have to take this away from the time.
They work.
Okay, well, good afternoon, everyone. I'd like to provide an update on DoD's coronavirus efforts as we continue to focus on our three priorities: protecting our troops, their families, and our personnel; second, safeguarding our national security missions; and third, supporting the administration's whole-of-government approach to addressing this national health emergency. At the same time, I want to assure the American people that the United States military remains ready and capable of meeting all of our national security requirements. I just returned from a visit to Fort Detrick to see firsthand how DoD doctors and scientists are advancing vaccine and treatment efforts to combat the coronavirus. I was briefed on the Army Medical Research and Development Command's cutting-edge COVID-19 response, and then I visited the Army Medical Research Institute of Infectious Diseases to learn about its ongoing experimentation and testing. The Army's work on a vaccine is one of the many ways the Department of Defense is supporting President Trump's whole-of-government approach to fight the virus and substantially slow its spread. Many of the policies and guidelines we have released go hand in hand with the President's 15-day plan. We have issued international and domestic travel restrictions to all DoD personnel and families that should dramatically reduce potential exposure to the virus. Inside the Pentagon, we are practicing social distancing, minimizing person-to-person interaction, and, wherever possible, conducting virtual meetings. Employees who exhibit any symptoms of the virus are instructed to seek appropriate medical treatment, stay home, and telework as needed. Yesterday, I held 2 sessions with the department's senior civilian and military leaders and briefed Vice President Pence, Secretary Azar, and other task force leaders on recommendations for how DoD can provide additional medical and logistical support during this national health emergency. I'd like to highlight several of those today. First, the Department of Defense will make available up to 5 million N95 respirator masks and other personal protective equipment from our own strategic reserves to the Department of Health and Human Services for distribution. The first 1 million masks will be made available immediately. Next, we are prepared to distribute to HHS up to 2,000 deployable ventilators for use as needed. These machines are different from their civilian equivalents and require special training to operate, but we are committed to supporting HHS's requirements in any way we can. Third, the department has made our 14 certified coronavirus testing labs available to test non-DoD personnel as well, and we will soon offer 2 additional labs for that purpose. We hope this will provide excess capacity to the civilian population. Finally, we are considering activating National Guard and Reserve units to assist states with planning, logistics, and medical support as needed. In my conversations with governors and members of Congress about DoD's resources, I've made it clear that we will continue to support the administration's comprehensive efforts and the country every step of the way while ensuring our nation's security remains the top priority of the Department of Defense. I recognize our decisions impact service members and their families, and I want them to know that we're all in this together. If we can dramatically reduce the spread of the virus over the next 15 days, together we can help restore public health and the economy and hasten a return to our normal way of life. As circumstances evolve over the coming days and weeks, we will continue to take every necessary precaution to protect our forces, to safeguard our national security capabilities, and to support the President's whole-of-government fight against this virus. These are DoD's priorities, and we remain focused on them. Thank you, and I will open it up this time for questions.
Mr. Secretary, you mentioned you're considering, I believe you said, activating the National Guard. Are you talking about federalizing the National Guard? And also, could you explain in a little more detail what was said this morning in the White House about using or calling on the Army Corps of Engineers to help with either construction or renovation of facilities?
Yeah, first on the with regard to the Guard and Reserves, we're looking at all the requirements as they come in. We're funneling those into a central point. As you know, right now we have, I think, 18 states and over 1,500 guardsmen activated at different parts around the country. And so as we get requests in, we will look at activating them if we need to at the federal level or using the reserves, whatever the case may be. But we want to be very supportive with regard to our prioritization in terms of supporting the American people and the governors. With regard to your second question, I did not have a chance to observe the news conference, but my view is I'm more than willing to send the Army Corps of Engineers out to work with states and to see what we can provide, what we can offer. As you know, the Corps of Engineers is a contracting body that does program oversight and work, and if we can be useful, if we can help, I'm certainly willing to provide that service.
Patrice? Sure. If I could just follow up, what are we talking about in terms of magnitude of active duty troops that could be used? Are we talking 10,000, 20,000, 30,000? And are you, or the hospital Navy ships preparing to sort of deploy to assist with non-coronavirus cases?
So right now we're really focused on Guard and Reserve in that order. We haven't looked, because there hasn't been a need yet, a request for active duty. So we'll take all these requests in due time. With regard to the hospital ships, there are two. As you know, the Comfort is on the East Coast, the Mercy on the West Coast, in Norfolk and San Diego, respectively. The Comfort is undergoing maintenance, and the Mercy is at port. We've already given orders to the Navy a few days ago to lean forward in terms of getting them ready to deploy. They provide capabilities, but much like what DoD does provide, our capabilities are focused on trauma. And so whether it's our field hospitals, whether it's our hospital ships, they are focused on trauma. They don't have necessarily the space, the segregated spaces you need to deal with infectious diseases. And so one of the ways by which you could use either field hospitals, the hospital ships, or things in between is to take the pressure off of civilian hospitals when it comes to trauma cases, to open up civilian hospital rooms for infectious diseases. Now, for us, the big challenge, though, isn't necessarily the availability of these inventories. It's the medical professionals. All those doctors and nurses either come from our medical treatment facilities or they come from the reserves, which means civilians. And so what we got to be very conscious of and careful of as we call up these units and use them to support the states, that we aren't robbing Peter to pay Paul, so to speak. So what I don't want to do is take reservists from a hospital where they are needed just to put them on a ship to take them somewhere else where they are needed. So we got to be very conscious of that. And as I've spoken to a couple governors today, we talked a little bit about that. And I think people are beginning to understand what that trade-off means.
You know, at the White House today, they said they were, you know, they don't want to have the Guard go everywhere, I guess. They said let's focus on the hot spots. So that would presumably be California, Washington State, New York. Is that kind of where you're looking at early on to provide?
Well, keep in mind the Guard is already available to the governors. They know that. They have their tags and everybody, so it's a resource available at their fingertips. What we want to do is make sure they understand all the capabilities of the Guard, how it may best be used. I've had a chance to talk to General Langell, who's director of the National Guard Bureau. We've talked a few times. He's talking to the tags. He's having multiple phone calls each week to cross-level. So that is available to them. I think, you know, in some ways we want to be the last resort, right? We're the ones when everything really is neat. We can come in rather than being the first and really help enable through the Guard and Reserve to play that role initially.
And also, I'm hearing that there's talk of maybe appointing a senior officer, maybe a 3-star, to coordinate among all the various federal agencies. Is that something you guys are considering?
The two principal representatives at the day-to-day meetings with the VP and his task force are General Hyten and Deputy Secretary of Defense Norquist. Those are our representatives. General Hyten has a lot of capability. He can tap into all of DOD as he sees fit. Of course, we have NORTHCOM, who supports in terms of the Northern Command AOR. But this isn't like a hurricane where you can pick a general. This is nationwide. So I think what you're going to see is you'll see whether it's local commanders or tags in this case stepping up and as their states encounter these challenges, and them being the focal point at the state level.
Courtney?
Can you say a little bit more about the 2,000 deployable ventilators? How many, I'm assuming that takes uniformed service members to operate and train and whatnot. How many would that take, and where are they coming from? And can you say where they're going yet? Or presumably New York, but...
No, I can't say where they're going. We've made them available to HHS. HHS would have to determine the prioritization. They are in stocks in some cases. We'd have to get you more detail on where they are, but obviously they're spread out to support our medical deployability. And yes, these require some special training. What we'd have to do, and I informed when we talked about this the other night with the Vice President and his task force, is we'd have to do a train the trainer, if you will, maybe provide some people to make sure that the civilians who would use them know how to use them properly. They're unique in terms of deployability. They got single-use functions in some cases, so they are different than what you would find on the civilian end because they're meant to be deployable. Right?
So would it be 2,000? I mean, presumably if it's 2,000 ventilators, is that 2,000 service members who would have to be used to train?
I would be speculating, but I would say no. I would say one person can train a multitude of people to learn how to operate them, and maybe you have them outside as an outside, to help with maintenance or things like that. But I don't think the numbers, we could do the math and get back to on that, Courtney, and see.
Jennifer?
Can you give us an update, Secretary Esper, about what Fort Detrick has found in terms of their vaccine? How far along are they? And since you're encouraging people to telecommute, why did you feel the need to be there in person and have meetings with people in person? Shouldn't that commuting start now?
Well, we're doing a lot of telecommuting every single day. I telecommunicated with the Deputy Secretary of Defense this morning from my office to his office. So when I went up there, we had all the social distancing stuff worked out, the space. But the chance to talk to the doctors face-to-face, and I wanted to see their labs, I want to see where they're working, is really helpful to me to get an understanding of what they're doing. So we put all those precautions in place. If anybody knows how to do it, they know how to do it. What I will tell you is they're working out on a number of fronts. As many of you know who've been here before, they've been very successful in the past, whether it's dealing with Ebola or Zika. They have incredible capabilities. They're well-knitted, extremely well-knitted into the interagency efforts. Their relationships with either Dr. Birx and Dr. Fauci are remarkable. And, in terms of their ability to understand the virus, what it does, and they're at the point, too, in terms of the ability to soon purchase machines that could do the testing at incredible levels of capacity and throughput, is one of the things that they briefed me on that should be coming online in a couple months or so.
But how far along is the vaccine?
I think they gave me the same numbers that they gave all of you, 12 to 18 months, the normal course. As I understand it, there's some private actors out there who think they could do it quickly. But in terms of how we do it, it's looking at 12 to 18 months. And of course, where they can provide support is if somebody does develop a vaccine, we could run it through our system very quickly as well and support those efforts.
Barbara?
Mr. Secretary, 2 questions. First, could you bring us up to date when you talk about the Corps of Engineers, your latest assessment of what are the next steps are with the state of New York? Because Governor Cuomo has been so open publicly about his request. But first, I wanted to ask you, you talked about using the U.S. military active duty, the Defense Department, as, in your words, a last resort, not the first resort. Mm-hmm. I do want to press you on a bit on that, because the country's being told this is unprecedented, really dire potentials are being sketched out to the American public. Is it, in your view, is it time to think in non-traditional ways about using the active duty force? Should it be the last resort?
Well, when I talk about active duty force, I don't mean about people per se supporting in terms of planning logistics. I'm thinking about is our medical capacity with regard to our treatment facilities, things like that. We have to treat our own populations. our own populations will likely be, in terms of beneficiaries, susceptible at the same rates as the civilian population. So we provide a little bit of flex. If you compare us to VA, they have many, many more hospitals. So that's kind of how I think about it. We got the Guard is available to handle stuff, and the active component will stand. We're ready to support in any which way we can. I'm just suggesting I think a lot of this has to begin at the state and local level in terms of in helping enable them.
Do you think that the military population, very often described in this room as young and healthy, is susceptible to the virus at the same rate as the civilian population? And I would like you to address New York if you could.
Well, don't turn me into a doctor that I'm not, but I will tell you what I said before is we have a very young and healthy and fit military population, which seems to imply, based on what we've seen so far, that they are less likely to contract and show symptoms at the rates of people older than them. Now, of course, many of them, another part of our population are dependents and beneficiaries who range from young kids to senior citizens. So I got to worry about that population as well. That's about 3.8 million people who live within 40 miles or so of our 36 military treatment facilities. So I'm looking at that population as well. With regard to the uniformed people, I do think they are very fit. I think that they will fare well throughout this. We watch them and protect them and as need be test them. But again, I think in terms of the military population, they'll be fine. With regard to New York, I hope to have a call with the governor here sometime soon. I've been trying to talk to I've spoke to 2 governors today, find out what his needs are. As I speak to governors and others, I say, tell us what your needs are, and then we'll figure out the best way to meet them, whether it's logistics, planning, medical, whatnot, and then we can look at the various ways we approach it. Is the National Guard the first place? If not them, then the reserves. Active component is there as well to support. So we kind of triage the problem to make sure that we understand what all the trade-offs are. Again, what I think's been explained to you all about field hospitals and hospital ships, and the simple fact that many of those medical professionals who staff those units come from the private sector is something that most people are not aware of, and we got to be very careful that we don't take from one part of New York medical professionals who are needed to stand up a field hospital simply to help another part of New York, unless, of course, the governor recognizes that. And, of course, we can also do state-to-state stuff where states share. And I had a conversation earlier today about that. So we're looking at putting everything on the table.
All right, we're going to try to go to the phone line, and we'll take our first question from Jeff Schogel from Task and Purpose. Jeff?
Thank you very much. It has come to our attention that despite the fact that the Pentagon is teleworking, commanders continue to have all-hands formations and town halls to discuss a variety of topics. Will the Defense Department order a moratorium on all large gatherings like town halls and all-hands formations?
The short answer is no, at least not at this time. I trust the commanders to lead their units and take care of them appropriately, and that has not been raised to me as a problem at this point in time. So again, my view is the commanders have the authorities they need to take whatever precautions, but while at the same time ensuring the readiness of the troops and the capabilities of our formations.
Okay, Missy Ryan from Washington Post.
Thank you. Secretary Esper, can you talk a little bit about the testing of service members that's being performed now? It seems, according to the most recent numbers we've seen, there have been about 500 people tested. Do you think that is adequate in order to detect the spread of the virus within the military community and halt its spread? And what are the criteria for testing?
Well, we can get the Joint Staff Surgeon back up here to talk about that, to give you the exact details. My view is if you are symptomatic, you should definitely be tested. Otherwise, there's no plans to test all 1 million or so active duty personnel. That is, I don't believe, something we need to do at this point in time. But again, I'd rely on the Joint Staff Surgeon to kind of give us, to fill you in with regard to how that is. But if you're symptomatic, you definitely should be tested. In some cases, if you've been exposed, you should be tested, but we're not at that point yet to order across the formations.
Lee Hudson, Aviation Week. Okay, back to the room.
Mr. Secretary, could you give us some sense of timing here? How long does it require you to activate a reserve unit? If the governor of New York wants you to get the Army Corps of Engineers contracting to renovate hospitals or build new ones. We learned with the wall that still is a contracting process that takes time. So how long would it be before the U.S. military really started having an impact in terms of hospital beds?
Yeah, it's another great point that as I talk to people, I try and share with them. So let's take your second part first. With the Corps of Engineers, they do great work, very good program managers, but they have a number of federal rules and regulations they follow. They have a very expansive contracting process, and that takes time. The Corps of Engineers does not build projects. They contract others to do the projects. So my hunch is it would probably be quicker if it's done at the state or local level. But nonetheless, I don't mind offering up the Corps of Engineers to come to a state to talk to whoever a governor wants them to speak to about with regard to renovating buildings or whatnot, to see if we can do it quicker. We're prepared to do that. But I think at this point the key is speed. But again, I need to have those conversations with the governors and others. With regard to your first question, you're right. It takes, look, I spent a lot of years in both the Guard and Reserve, and it takes time to activate people. Depending on the type of unit, you have to activate the person, but then you have to draw equipment. You have to do any number of things. And then in all cases, you have to, again, be very careful that you're not pulling somebody out of a part of the civilian sector where they're needed. We keep talking about medical professionals, but it could be law enforcement. It could be firefighters, whatever the case may be. So that takes a little bit of time, too, to make sure we're making the right decisions with regard to who we call up.
So you're describing a process that sounds like it's going to take weeks, not days.
Well, it could, depending on, I don't have any hard requests, maybe one or two right now, but if you're thinking about calling up the Guard Reserves, it's not hours or days, it's probably days or weeks, and more like weeks, but it depends on the type of unit, where they're located, what they would have to bring to the mission, et cetera.
What are the hard requests?
Let me go to somebody else.
Thank you, Mr. Secretary. At the White House briefing today, the President suggested that there's actually been some discussions about potential sites for field hospitals. Have you been advising on where these sites could potentially be, maybe Washington State? And then secondly, on the ventilators, with the 2,000 that you're sending out, can you give us a sense of, if there's greater need than that, if this gets worse, how much further can DoD surge before it needs to reach out to maybe the private sector or other places?
Well, I think again, second question first, we can offer up to 2,000 doing that. That's why I like to say the key thing right now, when you look at the numbers of people that are projected that may need ventilators, 2,000 doesn't put much of a dent into it, but we can offer what we have. But I think the key thing is the private sector, the manufacturing side, whoever makes medical machines of this type, is how do you prime that pump to get the production? Because we're simply not going to be able to meet the demand if the demand fits some of the profiles that we've seen the CDC brief. And then location of field hospitals. Again, I think it's a case-by-case basis. It has to depend on a conversation with the governor or the state or local authority. My view is the best use of our field hospitals, because they're geared toward, is trauma. So ideally what you would do is locate it somewhere, maybe next to a hospital, whereas trauma patients come in, instead of going into the hospital, they would go into the field hospital, where we could treat the broken legs, the lacerations, the falling down, hit your head type of stuff. We can handle them in our big open bays. We have our doctors that can do that. And if you come in for a COVID, we've now freed up rooms for you to go inside the hospital, where you have segregated rooms with bathrooms and all those things you need to treat infectious patients. So, not a doctor. I was an infantryman, not a medical professional, but my hunch is you'd want to do some type of co-location next to where medical facilities are. But that all has to be worked out with the local state and or municipality to make sure how can we best support, if that's the support they need.
Last question. Sure, are you right? 2,000 is the upper limit.
That's what we can offer right now. That's right.
Last question. Thank you. Pat Becker from Defense One. The Defense Advanced Research Projects Agency currently has a program to develop an antigen. It's kind of like a vaccine, but a little bit more proximate. It can potentially shield troops or anybody else from contracting the disease for a period of time until a vaccine becomes available. Can you describe, based on your conversations today, what the readiness level is or the level of preparedness for any sort of COVID therapeutic that might be in development by the U.S. military?
Yes, I'm not tracking the DARPA one. I hope to go see them sometime here soon to find out where they are in terms of their work. They are part of all this too. But with regard to USAMRIID, where I was today, they're working on two parts, both the vaccine and then the treatment piece, which is the therapeutics and so they're moving along on both fronts. I didn't get too detailed of a briefing on the second part. I focused a lot on the vaccine side. So, but that's something we can get the Joint Staff Surgeon to come and brief you all about. Okay?
Thank you.
Good.
Can we just get an update on the situation in Iraq, given
We'll do that another day. Today's coronavirus, that's my focus right now. Thank you all.